The menopause is a situation that usually occurs between the ages of 45 and 55 to all ladies, where the hormones that governed the menstrual cycle in the earlier years begin to change, and then various symptoms develop as a result of that. So it can be quite variable. Some ladies may not be alerted with too many problems. It's obviously a matter of the period, the menstrual periods stopping, being skipped, and eventually completely stopping altogether. Other women at the other end of the spectrum have a very severe experience. They are oftentimes debilitated by hot flushes and night sweats, quite significant mood symptoms, mood disturbance as well, usually related to anxiety, sometimes depressive type symptoms. There can be joint pains and also some vaginal and urinary bladder problems as well. Well, the symptoms of the menopause can actually overlap with some other health conditions as well. So the first thing is, certainly extreme tiredness and fatigue is to make sure that there are no other problems such as vitamin deficiencies, iron and vitamin D deficiency, for example. I think it's very important to consider one's overall physical and mental health, because actually simple lifestyle changes such as maintaining a good weight, moderate exercise, very healthy eating lifestyle, avoiding excessive alcohol and not smoking, these things in themselves can actually start to address many of the symptoms, and many women will be adequately treated with that alone and won't actually need to take any tablets. On the other hand, after you've done that, if you're still experiencing extreme symptoms, particularly flushes and sweats, then there can be an option such as medical therapy. So this is commonly known as hormone replacement therapy, or HRT for short. And this type of treatment can involve many different modalities. So oftentimes it can be tablets, there's patches, there's gels, creams, sprays, and even hormone coil that can be fitted as well. There's lots of different options for women. Well, it is on average about 10 years that treatment is required for those who commence treatment. It can be a little bit shorter for women who don't need treatment. But the most important thing is that guidance has changed now, and there are no arbitrary limits to the duration of use of HRT. So the most appropriate way is to assess a lady's requirement for HRT and to start her on the safest, lowest, most efficacious dose, and review that treatment annually with a view to weaning her down or reducing the strength of the preparation over time when she needs a less strong preparation. So in terms of the formalised HRT, hormone replacement therapy, contrary to common belief, actually HRT is very, very safe, and it's really important that when a lady's considering the treatment, she has a full what we call risk assessment to consider her own individualised risk. So the main two things that people talk about are clots, or thromboembolic disease, which is a clot in the leg that can travel to the lung and be potentially quite serious. Not all forms of HRT are associated with an increased clot risk, but this is certainly something to be considered. The other well-publicised risk is a risk of breast cancer. So if you put it in context, it's now approximately just under 1 in 8 women will suffer with a diagnosis of breast cancer during their lifetime. So the biggest risk factor for breast cancer is actually being female and having breasts. The next biggest risk factor is being older. So again, in context, bearing in mind the high prevalence of this most common female cancer, there's an extra 1 case in every 200 HRT users for estrogen-only HRT, and there's an extra approximately 1 in 60 cases for everybody taking the combination therapy. So in context, it's actually not a significantly increased risk. And I think the important thing is to consider the benefits of HRT, particularly in relation to osteoporosis and in relation to cardiovascular disease. And certainly the reports published by the Royal College of Obstetricians and Gynecologists have concluded that your overall risk of death by any cause is lower if you take HRT in comparison to those women who don't take HRT. So I think the first thing to do in the first instance is to see your general doctor. Certainly you can see your gynecologist if you have one already, and that individual will be qualified to make the appropriate risk assessment, individualise your case and recommend the most appropriate treatment for you, and of course recommend monitoring for you as well.